Hello, everybody. Welcome to Ms. McGuire online video lecture. And today we're covering the reproductive system. We will discuss male reproductive system in this video. So let's go ahead and begin. So reproductive system has 4 functions. So first, let me pick up my pen. So first, to produce eggs and sperm cells. And of course, if we're producing ova, then we're talking about female reproductive system. If we're talking about sperm production, that's a function of male reproductive system. Second, to transport and sustain these cells, eggs and sperm. Function number 3, to nourish the developing offspring. Well, this is a function of female reproductive system. And function 4, to produce hormones. So let's go ahead and compare briefly male and female reproductive system. So definition, male reproductive system is the organ system that produce male gametes. Female reproductive system is the organ system that produces female gametes. Main components, male system, scrotum, testis, spermatic duct, sex glands, and penis. Female system, ovaries, fallopian tubes, or what we call them now ovarian tubes, uterus, vagina, and vulva. And vulva are external genitalia of female. Hormone produced for male reproductive system, testosterone, and female reproductive system, progesterone and estrogen. Location in the body, male, mostly located outside the body, female, mostly located inside the body, except for the vulva. Gamete production for the male reproductive system takes place in a cold environment. Well, it's not really cold environment. It's about 3 degrees Celsius cooler than body temperature. So it's not really cold. It's just cooler than normal body temperature. And female production of gametes take place in the warm environment, and specifically what warm? Not 110 or 20, right? It's a body temperature. Okay. So primary organs of the reproductive system are gonads. Gonads are testes and ovaries. Gonads produce gametes or sex cells, sperm, and ova, and secrete steroid. Steroid means lipid soluble sex hormones. Androgens for males, testosterone is an example, and estrogen and progesterone, females. And accessory organs. So we're talking about organs of reproductive system, primary organs and accessory. So accessory reproductive organs includes ducts, glands, and external genitalia. And this is for both male and female. Anatomy of the male reproductive system. So main organs are testes, the sperm-producing male gonads that lie within scrotum. So if you look at a diagram here, you can see that scrotum is outside of body cavity. And then we have system of ducts, including epididymis, Ductus Difference, ejaculatory duct, and urethra, and accessory organs. Now for male reproductive system, accessory glands include seminal glands, prostate, and bulbourethral gland. So here's our bulbourethral gland at the base of penis. Here's prostate, inferior to urinary bladder, and seminal vesicle or seminal gland is posterior to the urinary bladder. Scrotum is a sac of skin and superficial fascia. It hangs outside abdominopelvic cavity. Contains paired testes 3 degrees Celsius lower temperature than core body temperature, and low temperature is necessary for sperm production. Midline septum divides scrotum into 2 compartments, one for each testis. Temperature is kept constantly by 2 sets of muscles. Temperature is kept constant, by a set of 2 muscles. So we just mentioned that we need temperature 3 degrees Celsius below core body temperature for sperm production. Now, how we regulate this temperature if testes are outside of body cavities? Well, we have 2 sets of muscles. Dartos muscle is a smooth muscle that wrinkles scrotal skin and pulls scrotum close to body. So here's the testis with skin and superficial fascia partially removed. So first we see the septum, right, that we talk about, that divide scrotum into 2 compartments. And then, so that's the scrotum is a sac made of skin, superficial fascia, and some muscles. Now, inside the walls of scrotum, this muscle over here is a dartos muscle. That is smooth muscle. That means you cannot control it, and it wrinkles scrotum. So when the temperature is cold, and if scrotum is wrinkled, right, so it's bring it close to the body and warm up testes. Cremaster muscles are skeletal muscles, covered testes, shown over here on this diagram, and they elevate testes, and you can control cremaster muscles. Now, both set of muscles are needed for temperature regulation. Each testis is surrounded by 2 tunics. Tunica vaginalis, that is outer layer derived from peritoneum. Now, if you remember, peritoneum is a serous membrane found in abdominal and partially in pelvic cavity. Because it's a serous membrane, it always has 2 layers that will be parietal tunica vaginalis and visceral tunica vaginalis. Right, like any serous membrane, it has parietal and visceral layers. Right, so here we have parietal tunica vaginalis and visceral. And the inner layer that forms fibrous capsule of the testis is called tunica albuginea. And albuginea means white, like albina, right? So it's just structure that white in colors. That's why they call it tunica albuginea. Okay, so here we can see anatomy of the testis again, scrotum that made of skin and superficial fascia that contains our dartos muscle. Then we have cremaster muscle. We have a septum that divides scrotum into 2 compartments. And then we can see the tunica vaginalis, 2 layers, and tunica albuginea of the testis. Now, testis. Septa divide testis into about 250 lobules, each containing 1 to 4 seminiferous tubules. So here's a diagram, right? We have our tunica albuginea, that is connective tissue making a capsule of the testis. Inside, you have tubules. So you see how these convoluted tubules shown over here, those tubules are called seminiferous tubules. And we have septa that divide testis into lobules, right? And in each lobule, you will find the seminiferous tubules. They are site of sperm production. So sperm is produced inside seminiferous tubules. From seminiferous tubules, sperm will move to straight tubules. So you can see kind of like straight over here. Then rete testes that are network of tubes. Then efferent ductules that is right there. Efferent ductules, and then epididymis. Now this structure over here, that's epididymis, right? All up to this point. So that's epididymis. Now all of these structures, even they have different names, seminiferous tubules, straight tubule, rete testes, efferent ductules, epididymis. Those are just the tubes. Right, so tubes that sperm is produced inside these tubes and start moving through these tubules to the finally urethra of the penis, and then to vagina. Testis blood supply. We have testicular arteries that arise from abdominal aorta. So you can see on this diagram, that's abdominal aorta, here's testicular artery. Testicular veins arise from pampiniform venous plexus. Now, if you see over here, that's our pampiniform plexus. Plexus, it just tells you we have lots of blood vessels that interconnected, makes a network of blood vessels. So plexus is network. It can be network of blood vessels and it's venous plexus, for example, or it can be nerve plexus, but the word plexus means network. So we have this pampiniform plexus and then testicular veins that arise from this plexus and bring blood to the inferior vena cava. It's interesting over here how the right testicular vein connected to inferior vena cava and a left testicular vein connected to renal vein. All right, so kind of like no symmetry over here. Now this plexus surrounding each testicular artery, so here we will have like arteries, right? And they will be, the plexus surround arteries, and what it does, it cools the testis. It absorbs heat from testicular arteries and keeps testis cool. And we remember again that we need testis to be cool, cooler temperature for normal sperm production. Then we have structure called spermatic cord. So here's a spermatic cord that encloses nerve fibers, blood vessels, lymphatics that supply testis. Right, and inside this spermatic cord, so you will have our blood vessels, you will have nerve, lymphatics, right? But also you will have structure called ductus deferens. And ductus deferens is the so you have testis, right, with seminiferous tubules, and you have epididymis, and then from epididymis we have ductus deferens. So sperm will travel inside this ductus deferens, right? First, the ductus deferens will enter the pelvic cavity, and then it will be connected to urethra. So it carries sperm. Penis consists of a root and shaft, ends in glans penis. So here glans penis, then body of penis or shaft, and root. Prepuce or foreskin, it's a cuff of loose skin covering glans, and circumcision is surgical removal of foreskin. Internally, penis made up of spongy urethra and 3 cylindrical bodies of erectile tissue. And these cylindrical bodies are called corpus spongiosum and 2 corpora cavernosa. Corpus spongiosum surrounds urethra and expands to form glands and bulb. So if you see here, they break this penis into 3 parts. So that's a cross section. You see, this is a yellow part shown here in yellow and 2 green parts. Now this yellow part is our corpus spongiosum. So here's our corpus spongiosum that expand into glands and a bulb. In corpora cavernosa, we have 2 of these structures, paired dorsal erectile tissue. And corpora cavernosa expands into crus. And the penis is attached to pelvis and a membranous structure over here, to a membrane that is pelvic floor, through this crus and bulb. So crura, now you see, like, crus is singular. If you have 2 of them, we call it crura. Crura is proximal ends of corpora cavernosa surrounded by ischiocavernosus muscle and anchors penis to pubic arch. And just remind you where the pubic arch is, right here. That's a part of your pelvis. Erection. Erectile tissue fills with blood, causing penis to enlarge and become rigid. And to dilate those blood vessels in the penis, we need nitric oxide, that is vasodilator. So here's our flaccid penis, lateral view and transverse view. So again, this is our corpus spongiosum, and inside is urethra. That's a part of urethra is called spongy urethra. And then we have this 2 corpora cavernosa. And on the picture below, you can see that penis is rigid and erected because we have blood vessels that are filled with blood, right? And not only we fill those capillaries with blood, we also retain them in a penis that in dilation of these blood vessels and accumulation of blood cause a tissue to swell and erect the penis. Right, so over here, so number 1, cavernosal arteries dilate, engorging corporal tissue with blood. Engorging causes corporal tissue to swell, erecting the penis. And engorged corporal tissue compresses penile vessels and venules, maintaining erection. So you compress this vein, and you kind of like doesn't allow blood to flow from capillaries into venules. So you keep this blood supply inside those arteries to increase time of erection. Let's put it this way. Male perineum. It's a diamond-shaped region between pubic symphysis, coccyx, and ischial tuberosity. So that's a triangle that female also have female perineum. So it's a pubic symphysis. So here's our pubic symphysis. Remember what pubic symphysis does? It connects 2 hip bones together. Then coccyx on the posterior side, and ischial tuberosity is inferior part of the ischium. So if you're sitting right now, you're sitting on ischial tuberosity. Male duct systems. Duct carries sperm from testis to body exterior, right? So we make sperm inside seminiferous tubules of testis, and we have these duct systems that allow us to carry sperm to the exterior. And a duct system includes epididymis, Drs Difference, ejaculatory duct, and urethra. So that's the first part over here. That's epididymis. This tube that is located inside the spermatic cord. Sorry, just forgot this word. Inside spermatic cord, that's called Ductus Difference, and it enters the pelvic cavity, right? So here's still Ductus Difference. Then Ductus Difference, it has okay, so this is Ductus Difference, and this is seminal vesicles. So they both have ducts, and those ducts come together, forming ejaculatory duct. So this part is ejaculatory duct, right here. And then ejaculatory duct connects to the urethra, and here's urethra inside the penis. Right, so we have urethra inside the gland, prostate gland, that's a prostatic urethra. Then we have membranous urethra, and then we have spongy urethra inside the penis. So the function of all of this duct system is to carry sperm outside the body, to body exterior. So here's the first epididymis. It's made of head that contains efferent ductules and located on superior aspect of testis. So here's the head. And this tubes shown here in yellow, that's our efferent ductules. Then we have body and tail that located on posterior lateral area of testis. So here's the body and tail of epididymis. Now, epididymis is 19.6 feet long, or 6 meters long. That's a really, really long tube. Now, non-motile sperm, so sperm, remember where sperm is formed, inside this seminiferous tubules. But this sperm cannot swim yet. It's non-motile. So it's enter the epididymis and pass slowly through the epididymis and become motile. So it's take about 20 days for sperm to travel through epididymis. And it also can be stored inside epididymis for several months. During ejaculation, epididymis contracts, expelling sperm into ductus deferens. So epididymis shown here in green, and then ductus deferens, or old name is vas deferens, shown here in blue color. So ductus deferens or vas deferens is 18 inches long. It passes through inguinal canal to pelvic cavity. So the part of the ductus deferens, sorry, it's outside of body cavity. Then it moves up and enters pelvic cavity. It expands to form ampulla. So this is a posterior view. This is urinary bladder. And here's our ductus deferens moving behind the urinary bladder, and it expands, forming ampulla. Joins duct of seminal vesicle. So here's a seminal vesicle. So it joins the duct of seminal vesicle and forms ejaculatory duct. Now here's your ejaculatory duct right here in this square that I just draw. Smooth muscles in walls propel sperm from epididymis to urethra. So that's also muscular tube. The same as epididymis and ductus deferens. Those are all muscular tubes, and they can contract. The smooth muscles can contract. Now, if you heard about vasectomy, it's a cutting and a ligating ductus deferens. So if we cut this duct or we tie it or ligate, then sperm, even sperm is produced inside seminiferous tubules. It cannot move to the urethra, right? And that means male with who went through vasectomy is not fertile, so cannot fertilize an egg. If we don't have sperm in a semen, then no fertilization will happen. Now, urethra. Male urethra conveys both urine and semen, but at different times. Has 3 regions: prostatic urethra, surrounded by prostate. So here's the urinary bladder. Inferior to urinary bladder, we have prostate gland. So inside the prostate gland, we have prostatic urethra. Intermediate part of the urethra or membranous urethra in urogenital diaphragm. So that's a part of the pelvic floor. So that's a urogenital diaphragm. And here's urethra right kind of passing through this membrane called membranous urethra. And spongy urethra runs through penis. It's inside the penis and opens at external urethral orifice. Male accessory glands. And we're going to start with seminal glands. They are located on posterior bladder surface and produce viscous alkaline seminal fluid. So that's a posterior view. This is urinary bladder. Now, this is Ductus deferens and ampulla of Ductus deferens. And just next to it is our seminal gland or seminal vesicle. Seminal vesicle produce about 70% volume of semen. And the secretion, this fluid that is produced, contains fructose, citric acid, coagulating enzymes, and prostaglandins. Duct of seminal gland joins Ductus deferens to form ejaculatory duct. So we already talk about it. So here's our seminal vesicle, here's its duct, it joins the duct of Ductus deferens and forms ejaculatory duct. Prostate gland encircles urethra. So urethra will be inside. So it's encircles urethra, inferior to bladder, size of peach pit, secretes milky, slightly alkaline fluid, contains citrate, enzymes, and prostate-specific antigen, or PSA. Now, this antigen needs to, for very important in fertility of male, and it's also used to, so the amount of this antigen in the blood serum can be indicator of either prostate cancer or enlarged prostate gland. Prostate gland plays a role in sperm activation and makes up 1/3 of semen volume. And 2/3 of semen volume is made by seminal vesicles. And then bulbourethral gland is a pea-sized gland inferior to prostate, so right here, produce thick, clear mucus during sexual arousal, lubricates gland's penis, and neutralize traces of acidic urine in urethra. Right, so here we have our diagram that you guys can just pause over here and look at all these parts. And this is posterior view. Semen. Now, how semen is different from sperm? Well, the sperm are just the cells, right? Those are gonads. Gametes, sorry. The gametes produced by gonads. Now remember, gonads are testes, and they produce gametes that are sex cells. They have 23 chromosomes, and they're important in reproduction because sperm will fertilize an egg. So those cells, sperms, they are produced inside testes. But semen contains sperm, but it also contains their fluid. So it's milky white mixture of sperm and accessory gland secretion. So remember we just talked about seminal gland and prostate gland. So they produce semen and testes produce sperm, right? So 2 to 5 milliliters of semen are ejaculated and they during one intercourse, and they contain 20 to 150 million sperm per milliliter. So it's a lot of sperm. So imagine if you have 250 per 1 milliliter, and then 5 milliliters are ejaculated, then it's like, it's, what is this, more than half of million sperm in one ejaculate. So semen contains fructose for ATP production, proteins, citric acid, sodium, potassium, enzymes that protects and activates sperm and facilitates sperm movement. Alkaline fluid of semen neutralizes acidity of male urethra and female vagina and enhances motility of sperm. So of course, sperm without semen would never survive, right? In an organism, not in laboratory. In laboratory, they might survive, but not in a living organism. Homeostatic imbalance, erectile dysfunction. Now we have, remember, we need nitric oxide to dilate those arteries and arterioles in penis for erection, right? So when parasympathetic nerves of penis release too little nitric oxide, then blood vessels are not dilated, not enough blood accumulated inside those vessels, and we don't have erection. That's why it's called erectile dysfunction. Now, possible causes: alcohol, drug, hormones, blood vessels or nervous system problem, incompetent venous valve that fail to retain blood in penis. And those famous drugs like Viagra, you probably heard about it, what they do that they mimic this nitric oxide effect, so they dilate arterioles of the penis. Prostate disorders. We have prostatitis, that is inflammatory disorder, can be because of bacteria infection, acute or chronic, and treated with antibiotics. Benign prostatic hyperplasia, it's when prostate became enlarged, right? So instead of normal size, now it's big. And it may be age-related, and prostate cancer, second most common cause of cancer death in males. So benign prostatic dysplasia, or what we call BPH. The prostate and surrounding tissue expands. The prostate goes through two main growth periods as a man ages. First period, early in puberty, when prostate doubles in size, and around age 25 and continues during most of man's life. While the prostate is usually the size of walnut, it can grow to be as large as orange. As the gland enlarges, it can squeeze the urethra, because remember, we have gland and urethra is inside, prostatic urethra. The bladder may weaken and lose the ability to empty fully. Urine remains in the bladder. This problem caused many of the lower urinary tract infections. And retention of urine and renal failure, if they happen, right, because of the benign prostatic dysplasia, that they require immediate medical attention. So BPH is benign. That means it's not a cancer, and nor does it lead to cancer. So it's not cancer and it doesn't lead to cancer. Still, BPH and cancer can happen at the same time, but it doesn't mean one leads to another. BPH itself may not require any treatment, but if it begins to cause symptoms, the treatment may help. And what's the symptoms? Well, as we said in the previous right? So either it can squeeze the urethra, that will cause problem in urination, bladder became weak, and it's not empties fully. It might cause infection. It might have also cause a renal failure. Then, of course, medical treatment is needed. Now, why are we talking about BPH? Because it's a really very common condition. About half of all men, half between age 51 and 60 have BPH. And up to 90% of men over age of 80 have it. So you can see that it's very common condition. So it's good to know about it. And if you look at this diagram, you can see how anatomy of the urinary bladder and prostate gland is related to this condition. So here's our anterior view. That's a bladder. And inferior to it, we have prostate gland. Now, urethra is passing through prostate gland. Now, look what happens when we have enlarged prostate, right? So not only, so it enlarges, it squeezes the urethra, and the patient cannot empty a urinary bladder completely. Right, okay. And that actually was the last slide that we are covering today. The rest of this PowerPoint covers female reproductive system, and I will record a separate video lecture the next time where I will cover female system. Okay, but thank you for watching, and I hope it was helpful.